Hello and welcome to our special COVID-19 update program here on Channels Television. I am Ladi Akiridoluale. The highlights for tonight. NLC President Ayuba Waba warns government against touching pension funds to cushion the effect of COVID-19 pandemic. Federal government receives 112.5 million naira in life insurance cover for frontline health workers in Nigeria. And U.S. death toll surpasses 50,000 as world leaders pledge to accelerate work on tests, drugs, and vaccines. We begin in Abuja, where the Presidential Task Force on COVID-19 has announced a life insurance cover valued at 112.5 million naira for 5,000 health workers responding to the COVID-19 pandemic. At today's briefing, the chairman of the PTF, Boss Mustafa, says the Federal Ministry of Health has signed a memorandum of understanding for allowances and several incentives for the health workers as well. He explains that premium insurance cover has been paid for, while promising that aggressive testing, contact tracing will still continue. This is coming after the government announced that 40 health workers had so far tested positive for COVID-19.
I'm pleased to inform you that the Federal Ministry of Health, working in conjunction with the MDAs and the health sector professional bodies, have signed an MOU for various allowances and other incentives. Pleased to inform you that in addition to what the federal government is doing, the insurance industry has responded massively to the call for support. The Presidential Task Force has received a life insurance cover to all frontline workers on COVID-19 for a maximum of 5,000 health workers who are employed to fight against the COVID-19 pandemic. The premium in the sum of 112,500,000 for cover has been fully paid by the Nigerian insurance industry in line with the principle of no premium, no cover. The PTF wishes to thank the insurance industry immensely and calls on other sectors of the economy to rise up to support the efforts to fight COVID-19. I also call on our frontline health workers to double their efforts, just as we want to assure them of our determination to protect them.
Meanwhile, the president of the Nigeria Labour Congress, Ali Waba, has advised against the use of workers' pensions funds as palliatives for cushioning the effects of the coronavirus lockdown in the country. Mr. Waba, however, announced that the NLC has produced face masks that will be distributed free to vulnerable workers in Abuja.
The contributing pension is actually not a free money. It's money that belongs to the pensioner. It is in the pensioner's retirement savings account. It is structured in such a way that he will continue to draw this money throughout his life. So clearly speaking, we need to protect those funds, and we need to also make sure that the pensioners or the workers that are contributing this money, at the end of the day, if they are not working, they should be able to have something to rely on. So clearly, I think it should not be used for this purpose. National Union of Textile and Garment Workers, particularly the tailors in Abuja, who are under that union, came up with a very wonderful idea to say that in order to support this fight, they needed to also think out of the box. They needed to use their skill and intellect to produce these locally made face masks. And they have so produced in large number. Our intention is actually to distribute free to other category of frontline workers. In fact, if you pass around the cities of Abuja, there are workers that their work is not so much recognized, but they contribute a lot. As early as 5 o'clock, I see people sweeping the streets. And these are people that don't wear masks. In most cases, trashes are thrown on the streets, contaminated. They pick them and keep our environment healthy. So first and foremost, we are going to distribute to them free, and also other category of paramedical staff that are also working, enforcing some of those decisions, but at the end of the day, they are not able to actually access this facility.
From Abuja, we go to Kano, where the governor, Abdullahi Ganduje, has flagged off the distribution of palliatives to residents who are likely to be affected by the lockdown and other restrictions put in place by the government. While handing out the food items and other essential commodities, Governor Ganduje assured the residents that the government will ensure that the palliatives get to those who need them the most. Our correspondent Idris Jibrin has more.
Food items, personal hygiene and medical facilities, as well as other essential commodities to be distributed across the 8 metropolitan local governments in Kano for the time being. This exercise is under the state government palliative approach to the coronavirus pandemic that is currently spreading across the state.
Those whose livelihood is on daily basis, and there's already a total lockdown, such people must be in serious problem. And we have 11,000 polling units. For each polling unit, we have taken 4 poorest of the poor households.
Representatives of each local government area receive food items, medical supplies, and cash donations for onward distribution to their communities.
Each of the beneficiaries will get either dawa bita or mosa bita with pasta or macaroni or indomie and cooking oil.
So far, the State Modalities and Distribution Committee confirms it has identified 300,000 households across the 44 local government areas of the state as those in need of help.
I'm calling on the general public to maintain the order, to maintain the social distance, and to be calm. His Excellency is giving assurance that he's going to make sure that each and every poorest of the poor household will get these items.
The fundraising committee and other members of the
with a promise to extend the distribution to the remaining 2 senatorial districts. Governor Abdullahi Ganduje further warns residents against violating the state government COVID-19 restrictions, especially social distancing and the use of face masks during the food collection.
A total number of Samovita.
Idris Jibrin, Channels Television News.
Idris Jibrin joins me from Kano City at this point. Good evening, Idris. What is the very, very latest of what's going on with regards to the COVID-19 response from Kano City?
Well, thank you very much, Ladiwa, and welcome to Kano. And like you see, the total lockdown of the state has resumed. And like you can see behind me, this is one of the busiest streets in Kano, but it's deserted. It's actually empty. And then as regards to the other related issues response that the state government is taking, yesterday the Kano state government announced the suspension of Ramadan Tafsir and the congregational prayers that used to take place during Ramadan. So the Kano state government has suspended all those worships. The government says that in terms of tafsir, the government will sponsor tafsir in various radio and television stations so that people will listen to tafsir in their homes. The state governor has also warned residents that wearing face masks henceforth is non-negotiable in Kano. All residents must be wearing face masks and they must adhere to social distancing. In terms of the issue of testing center that was earlier suspended, as of this moment, there is no any official statement that the test center has been reopened. what we are hearing is that they said the test center will be open tomorrow. But as of this moment, we have not heard any official statement from the health officials that the test center is reopened. But I asked the coordinator of the rapid response team regarding the test center. He told me that all their samples now, they are taking it to Abuja, and they are still waiting for some samples to be returned from Abuja, and that the NCDC has assured the state government that the testing center will soon be reopened in Kano State, so that the testing will continue in the state. And like you know, the evacuation of Almajiris on the streets of Kano has also continued. Hundreds of Almajiris have been taken to various states across northern region. And also yesterday, the Emir of Kano, Alhaji Amina Ado Bayero, addressed a press conference in which he called all residents to use the Ramadan period to observe a special prayer against the outbreak of this coronavirus. He also asked them to also abide by the advice given by health officials and do whatever it takes to ensure that they protect their children, they ensure a social distancing during this period.
Thank you very much, Idris, our correspondent Idris Jibrin, reporting from the city of Kano. Thank you very much, Idris. Now, joining me via Skype from Lagos is an associate professor of public health, Dr. Kemi Odukoya. Good evening, Dr. Odukoya. Thank you for being with us. Thank you for your time.
Good evening, Ladi. Thank you.
It would appear that some good news is coming the way of health workers with this insurance cover that the federal government has secured for frontline health workers, about 5,000 of them. But I wish to speak to, in particular, the susceptibility of health workers during this COVID-19 pandemic. What are the practical ways that they can mitigate their exposure to this virus?
Thank you, Ladi. Healthcare workers are very susceptible, as expected, because they are the people that COVID patients are going to come in contact with, first of all. Bearing in mind that many COVID patients will be asymptomatic, so it's difficult for healthcare workers to know that people might be positive. Now, the other thing to know with healthcare workers is that they are, if they do become positive, they are also placing other patients at risk and then placing their families at risk. So it's important to prioritize the prevention of infection among healthcare workers. Now, what can we do? The first thing is training and retraining. For all healthcare workers, we need to know that it cannot be business as usual. It's important for healthcare workers to be aware, to maintain a very high index of suspicion when patients come in, such that they can prevent health infection. It's important that PPEs are in place. Healthcare workers are the most important group of people that require the N95 masks. Sometimes it's a little disheartening to see these masks being worn by non-healthcare workers, and that drives the prices up and makes it difficult for healthcare workers to have these masks. So it's important that whatever we can do, we should do. Healthcare workers must be given priority, and as much as we can, we need to do whatever we can to make sure that they don't get infected.
We have heard earlier, before this time, we had heard that it is quite possible that within the hospital environment, which is where the health workers operate, the hospital environment is particularly susceptible to the spread of viruses, whether they are bacterial or otherwise. And therefore, even the hospitals need to take a closer look at their environment. What can you tell us about that?
The hospital environment. Now, it's important that we have an established triage. For every hospital, there needs to be a place. Before the patients come into the hospital, there needs to be a holding place whereby we screen patients and look at and try to determine the patients that are most likely or more likely to have COVID. The patients that are more likely to have COVID would be taken to a separate area with more scrutiny, and then those that might not have COVID will have to be treated. Because we have to remember that even though there is COVID, there are still a whole lot of people that have other non-COVID healthcare symptoms or healthcare problems, and they also need to be treated. So we need to make provisions for COVID patients and non-COVID patients while protecting the healthcare workers. And then the other thing I needed to say was it's important that healthcare workers are given priority when it comes to testing. It's important because when healthcare workers know
Dr.
their status.
Dr.
Yes.
Odikoya, we completely run out of time. Thank you very much for being with us from Asurulere in Lagos via Skype. Thank you so much for your time.
You're welcome.
As security operatives in the nation's capital try to enforce the lockdown order to stop the spread of COVID-19, they are faced with the challenge of many residents with exemption passes, which allow them to go about their businesses, especially if those businesses are considered essential services. The chairman of the lockdown task force says those excluded from the lockdown are too many, although compliance levels are getting better. Those with passes could pose a problem in attempts to contain the COVID-19 pandemic in Abuja. Our correspondent, Kayla Megwa, has more.
Traffic on the Kubwa Expressway. A lot of people here provide essential services, and those who do not are the reason for this traffic jam, because law enforcement agents must check each car to turn back defaulters.
I beg you in the name of God. Please, I beg you, please. Please, I beg you in the name of God. I beg you. They block the road.
What are you waiting for?
A closer look shows that almost everyone has a pass.
You need to go to the root of the matter before you even make your allegation. People will say any manner of things. Limiting that, yes, people are abusing this kind of privileges. This one is not FCD. It's not. Those who are providing essential services are meant to go to their place of work to provide such services. And once if this understanding has not been created at any particular point, the issue of this nature used to arrive. This is not new. We are used to it, and many of such cases have been addressed.
The chairman of the lockdown task force says there are too many people with passes in the nation's capital, and some religious leaders and transporters are still breaking the law.
We went around Wuse district, and we are shocked to find out that one Imam Isa Ismail, was still holding a worship service. We took him and brought him before the magistrate here, and the magistrate found him guilty and gave him a fine of about 2,000 naira also with community service. And very soon, most likely, you'll see the Imam do some community service here. And I think it's the need for us to have a greater understanding and greater synergy here. Sometimes some of those persons on essential duty, some of them have suspicious past. Some of them, their passes are not very genuine. I think we have to go and check that here.
Should the list of those considered essential services be reviewed? Should the government reduce the number of passes given to people? Whatever needs to be done has to be done fast, because having so many people moving about during the lockdown defeats the aim of the sit-at-home order.
After the break, we'll get a little bit more about the situation from Abuja with our correspondent, Kayla Megwa. Do stay on with us. Thanks for staying tuned. Welcome back to our special COVID-19 program. As promised, we go to Abuja now, where our correspondent, Kayla Megwa, joins me from somewhere in Abuja City. Good evening, Kayla. Trust you're keeping safe.
Hi, Ladi. Good evening.
Two interesting things stand out from your report. The issue of exemptions and who issues these exemptions and why so many people end up having them. Were you able to get any clarity on that?
Well, we're talking about it earlier with someone, and someone said, well, this is Abuja where everybody knows everybody. Everybody knows somebody. It was just interesting, just watching to say, okay, so the security operatives stopped the cars on the highway and trying to find out where are you going to. So we decided to stop and film them and see exactly what's going on, only to realize that almost everybody that was stopped was later on allowed to move, So we stayed wondering what's going on. Everybody had some sort of pass or the other. And then we found out as we moved around the nation's capital that some of these passes were fake. And some of them were just made up passes, and people were flashing them at security operatives and allowing them to move. So that's one problem on one side. Then there's the other issue of people that have legitimate passes. The task force chairman was talking to us today, and he said there were too many people with these passes. And because so many people have these passes, you're not going to stop them, It's a lockdown, not a curfew, he said. Now, if we have all of these people with so many of them passes that they can use to move around, doesn't that defeat the aim of the lockdown in the first place? So that's a question that I think I've been trying to find out. Doesn't that defeat the essence of the lockdown? The idea is for people to stay home so that people who are showing symptoms can come out, we can contain this disease. If so many people have passes and it's almost a competition for who can get a pass these days, then isn't that defeating the essence of the lockdown? So that's a very interesting dimension, Laddie.
Now, in terms of compliance, you indicate that it appears as if the compliance levels, in spite of what we've just talked about, seem to have, inched up somewhat. What can you tell us about that?
Yes, the task force chairman was telling us today how compliance levels between yesterday and today, or between day before yesterday and today, how it has gotten better. He actually gave the city center 70% and he gave the suburbs about 60%. The compliance levels, in my view, are actually pretty low, considering the number of people that we saw outside today, which is why we decided to find out why there were so many people out there. Now, apart from the people with passes and whether the passes are fake or real, there's so many transporters out there who are still picking up passengers all over the city center. It is one of the craziest things to see. People are still entering transport to go to places and they're not observing any of those rules of social distancing. That's going on. And of course, the unfortunate story today about the religious leader who led prayers. In fact, it was the imams in his locality that reported him to the task force, saying that he was leading prayers when all of them had decided not to, in obedience to the sit-at-home order. So we still have, pockets of these things going on in the nation's capital. This lockdown is supposed to end by Monday, and people are hoping that there won't be a follow-up lockdown. But I don't know how that is going to go. We're going to be watching to see how that pans out. However, there are still so many people flouting the rules, not providing essential services, with fake passes out there, still moving around, not helping to flatten the curve of COVID-19, Laddie.
Thank you very much, Kayla. Do stay safe out there. Our correspondent, Kayla Megwa, joining us from our Abuja studios, rather from the city of Abuja. In our Abuja studios is a medical laboratory scientist who is also the National Publicity Secretary of the Association of Medical Laboratory Scientists of Nigeria, Dr. Ifeanyi Kesmir. Good evening, Dr. Kesmir. Thank you for joining us at this time.
Yeah, good evening, Laddie, and Ramadan Kareem to our Muslim brothers and sisters.
Now, yesterday it was reported that over 40 healthcare workers have tested positive to COVID-19 in Nigeria. Let's talk about the susceptibility of the health workers who are doing the actual testing, those who come in contact with samples, and many of these are members of your group, the medical laboratory scientists. What is the protocol protecting them against contamination or coming into contact with viruses which probably are embedded in some of these samples?
Yes, thank you. Going by the protocol of intervention, we have test, trace, isolate, and treat. And that exactly shows the degrees of vulnerability of frontline health workers. Like you rightly said, the medical laboratory scientist is quite vulnerable because it's like the gatekeeper, is the case, it defines the case, and confronts the disease, COVID-19, naked. And so talking about protocol, you find out that what will make healthcare worker susceptible to outbreaks like this is when there's a compromise on the rules of engagement. There's always a rule of engagement. And so when that is violated, casualty level will be high. We're worried that well over 40 health workers have tested positive to COVID-19 in just within this short time. The worry is because if we continue to deplete our workforce, healthcare workforce, then the populace will become endangered. What can we do? What we need to do is to look at facility and safety. There are two prongs in facility and safety. One deals with the issue of primary barrier, and that is when we talk about personal protective equipment, which, of course, we know is in short supply globally. And since it is in short supply globally, what do we do? Judicious use of what is available. I therefore would expect that in concert with the Medical Laboratory Science Council of Nigeria, the National Center for Disease Control should develop a protocol that would define minimum PPE to be done per activity, from sampling to other processes that take place in the lab, including the places of isolation. Now, why am I talking about isolation? The isolation places is actually what will require more of the secondary barrier, because it deals with the issue of construction and design. And you find out that we have because of this outbreak, there are emergency arrangements being made to use different places not originally designed for this purpose. For that, we therefore must factor in issues of secondary barrier. It is very important. Again, is this: before we deploy our workforce, we must train them on the nitty-gritty of how to protect themselves. That seems, because we're under hurry, we're in a hurry to put people out, that may not have been properly and thoroughly done. Once the protocol is developed, if I want to go take an nasopharyngeal swab, this is what you must do, minimum, because of the scarcity we have currently in Nigeria. We're worried that because of contamination, the lab in Kano was shut down. We're happy to note that the DGNCDC said today that between now and Monday, that lab will come up. What, therefore, do we need? We need to train people more in batches. So if we have, as is the case in Kano, contamination and alleged infection of some of the laboratory workers there, we will have a ready replacement. It means that what the Federal Ministry of Health should concentrate on doing now is to build more capacity. And I have said that we are willing to give ample volunteer. We have well over 30,000 young medical laboratory scientists eager to volunteer their skills and competencies, particularly molecular testing. So as we look at the issue of healthcare workers that are getting infected, the case in Bauchi comes readily to mind. The 3 persons, all of them workers of the World Health Organization. Something must be amiss. Issue about training, orientation. Again, is that we must also consider, is there cases of malpractice? Is there cases of quackery? Are there cases of people overreaching themselves beyond their competencies and training just because there's a need to intervene? These are the things we need to consider. But for us, it is worrisome. We're happy that the government had taken out insurance for well over 5,000 workforce. We're also happy that government is beginning to look at the issue of hazard. But the point is, look at the 40 persons infected and the number that have died. The death and infection have no respect for any person or profession. It hits a nurse, it hits a medical lab scientist, it hits a doctor without asking you what is your profession. It simply means that whatever government is going to do for all these frontline health workers, government must take cognizance that the impact is same for all, and there must not be issues of parity, disparity, or discrimination.
Dr. Kesmia, thank you very much. But I need to ask you as well about going ahead. You've talked a lot about what now needs to be done, a lot of testing and a lot of other stuff. But in terms of where we are now, particularly with those who are in the front lines of this, medical lab scientists, doctors, nurses, and so on, what can you tell us? Do you have any information about what the situation is now in terms of PPEs and other such equipment that will protect them from some of these containment and other issues that have arisen as a result of their direct contact with patients and samples?
In one of the inserts that you played, there was a scene where sample was being taken. If you look at that individual that was taking the sample, yes, he had the overall suit, which is good. He had the hand gloves. But if you look at the head region, the entire head region is exposed. And so in the process of taking that nasopharyngeal swab and the patient or that individual sneezes, he's very vulnerable because there's no face shield. So as we talk to you, as we speak today, it is known everywhere that there's a short supply, there's a deficit in the supply of PPE. What we need to do as healthcare providers is to make sure that we judiciously use what is available across the country. It's very important. Yes, the insert is playing, well done personal protective equipment, but the head region is uncovered. It's very important the head region is covered because a splutter from that individual will go straight to his face. So that is why we are saying that for every stage of the engagement, from sampling, there has to be fine. The next one is properly kitted for that sampling process. That is exactly how it should be. But the worry is that we have this in short supply. Again, without this, it is dangerous to go sample anybody because the worry is most healthcare professionals who had gotten infected may have actually been infected by asymptomatic persons who had come to the hospital or healthcare facility for some other reason or had engaged for some other cause. The worry is this. Every person we need to put on the front line to work. From now henceforth, I expect that the National Center for Disease Control should get a baseline screening for such individuals. So look at the nurses you are seeing there. If they are the ones that are profiling profiling patients as they come to the hospital, I can tell you they are not properly kitted for that because it is not written on their foreheads. Until it is tested, you wouldn't say the status of any particular individual. So for us, what the government needs to do is to encourage local production.
We've completely run out of time, Dr. Kasmer. I believe that the point that you're trying to make has been very well heard by those in authority. Dr. Ifeanyi Kasmer, Publicity Secretary of the Association of Medical Lab Scientists of Nigeria, joining us from our Abuja studios. Now, the novel COVID-19 virus, which has continued to rage, has not only brought sorrow and pain to some, it has also changed the way many live. In our next report, our correspondent, Olu Philip, brings us the various shades of face masks and how people are protecting themselves.
Directive will be fully enforced.
February 2020, authorities announced that an Italian who came into the country tested positive for the novel coronavirus. Suddenly, what used to be a story heard about countries like Italy, Spain, China as regards COVID-19 became a reality in Nigeria. In a matter of days and weeks, our lives changed. The way we live, move, talk, and everything adjusted to new ways in a bid to combat the pandemic. It became more serious when President Muhammadu Buhari issued a lockdown directive in 3 states. To remain safe, you must wash your hands regularly. We were told you can't come too close to other persons. Proximity became an issue. Our sitting arrangements changed. Our meetings changed. Above all, we are told to wear our face masks.
I started listening to radio commercials concerning this. They will tell you it is not that you have to walk along the road with it. The only thing is that when you see somebody that is having cough, somebody coughing or whatever, you have to use your mask.
Wearing a face mask outside of a medical theater wasn't a popular thing to do, save for a few persons who chose that as style, like Nigeria's music maestro, Lagbaja, America's pop idol, Michael Jackson. Today, whether you like it or not, you can't afford the risk of not wearing one.
After we are done sewing it, we'll take it through a heating process. We have taken time and procedure to make it in a way that it can actually protect
you from either anything coming out of you in case for a person who is already infected or going in for somebody who is not infected. Basically, the mask is supposed to protect. But the unique part of it is that you're expected to take it out and wash it every time you wear it.
Not everybody, however, seems to appreciate the dangers of COVID-19 and efforts at tackling it. The disease is either a myth, a government creation, or they just can't be bothered.
I don't even get money to eat. As I did, it's hungry, they hungry me. I don't even see money to chop food, talk more of mass.
Last, like they say in a local parlance, Corona go go. Simply put, in the end, COVID-19 will leave Nigeria. No doubts, slowly but surely, Nigerians are responding to the challenge of the moment. At least you can see that with our fashionable marks of protection. Olu Phillips, Channels Television News.
Olu Phillips joins us now from a Abuja area in the nation's commercial capital, Lagos. Good evening, Olu.
Emeka.
Good evening, Olu. Can you hear me?
Yeah, I can hear you. I can hear you, laddie. I can hear you, laddie.
We've just gone through your report on face masks, but you're in the Abuja area of Lagos. Earlier on, there was a huge traffic pileup in that area. But what is the situation now, considering that we're supposed to be under a lockdown?
Well, laddie, I can tell you very categorically that every pretense that we are under any serious lockdown has since been negated, because we see vehicular movements every day. And one question you ask yourself is, are all of these people health workers? Are all of these people journalists? Are all of these people permitted to be on the road rather? And what we have not seen in any case is anybody being apprehended or turned back if they approach the road. We just see people drive to the checkpoint, they flash anything that looks like an ID card, get a pat on the back, and off they go. This is not the spirit of why we are experiencing lockdown here in Lagos. I'm in a busy place. As you can see behind me, people are still milling around, and all of the lessons of physical distancing seem to be falling on deaf ears. And this is one area authorities need to step on and make sure that this does not seep through the community, which has been the fear of a lot of people, that if the coronavirus, COVID-19, seeps through the community, the spread will be massive, laddie.
All right, then. Olu, finally, in 1 minute, what are the people telling you that is the reason why they are all out there, even this late at night?
This is very simple, laddie. We started with a medical issue. We started with a health issue. But soon after and shortly after, whilst we concentrated mostly all our energy in solving this health issue, a socioeconomic reality has dawned on us. And there's no gain saying this or begging the question as to the reality of these socioeconomic challenges. Yes, people have complained that they weren't carried along or were not given enough time to prepare as far as the lockdown is concerned. So you hear a lot of people always tell you, we can't stay at home because we are hungry. We can't stay at home because we need to do our businesses. We can't stay at home because we need to live for our food. We can't stay at home because the palliatives are not getting to where they're supposed to get to. We don't trust government enough to bring the palliatives to our doorsteps, so we have to step out. So you see, the balancing act as to how do we keep people locked in and also get them to obey while we deal with the medical issue is somewhat of a dicey thing for the authorities to deal with. But I think in the days ahead, this is what they really need to concentrate on and make sure that people who need to be in are in and those who need to be out are out while we're dealing with the medical issue and the health issues around COVID-19. But I can tell you clearly, yes, it is true that people are hungry, like they say, and they need to be out to do business and do some little businesses and make money and move around, go to markets like Mike 12. How do you stop someone, for instance, who is in a bus and tells you, I'm going to markets to buy something? So there has to be a strategy, for instance, where, okay, you could say that, okay, between 10 a.m. and 12 noon, any shopping you need to do, any groceries you need to do it between 10 and 12. Any other person found on the street, other than those who are permitted to be on the street, will be apprehended, laddie.
Thank you very much, Olu, our correspondent, Olu Phillips, reporting from the Berger area of Lagos. We trust that you stay safe out there, Olu. Thank you very much. We'll take a break, and when we come back, we'll get reactions to yesterday's announcement on the easing of lockdown in South Africa, plus the global COVID-19 update. Please stay with us. With 981 confirmed COVID-19 cases in Nigeria, the country inches towards the 1,000 mark. Of the 981 confirmed cases, 753 are the active cases being treated at different isolation centers across 26 states plus the Federal Capital Territory. 197 patients have been discharged. Sadly, 31 deaths have also been recorded. A state-by-state breakdown of the figures shows that Lagos remains the epicenter of the virus in Nigeria, followed by the FCT and Kano State. The number of confirmed COVID-19 cases in South Africa is put at 4,220. That's 4,220, with deaths up by 4 to 79 and 152,390 tests conducted so far. This comes as citizens have mixed views about President Cyril Ramaphosa's announcement on Thursday night on plans to implement a phased lift of lockdown restrictions imposed following the COVID-19 outbreak. Around the world, the UK COVID-19 testing website, which allows essential workers to book coronavirus tests, would be reopening this evening. It closed less than 2 hours after opening for the first time today, after significant demand for tests, which will either be taken at home or at special drive-through testing centers. Meanwhile, the World Health Organization has launched an initiative aimed at speeding development of safe and effective drug tests and vaccines to prevent, diagnose, and treat the novel coronavirus. The World Body hopes to raise $8.1 billion when it launches a global effort at the summit on May the 4th. Leaders from 20 countries, except the United States, pledged their support for the initiative. China has rejected calls for an independent international investigation into the origin of the virus, saying that such an inquiry is a politically motivated initiative that would divert attention away from fighting the pandemic. We'll end with good news as Italy records the lowest daily toll of coronavirus-related deaths in more than 1 month. The number of deaths rose by 420 to 25,969 in the past 24 hours. That's the smallest single-day increase since March 19th. And that's where we'll be wrapping up our COVID-19 special tonight. Thanks for being with us. Do join us from Monday when we reopen our COVID-19 special studios at noon, and we'll have updates at 6 and 9. But all through the weekend, we'll bring you updates on what's happening with this pandemic. I'm Ladi Akiri Gulwale.